Okay, so I'll start. My name is Olivier Joliat. I'm a Swiss guy. That's where my French-speaking accent is coming from the mountains. And I've been like 16 years here in this department, an extraordinary department for interdisciplinary research. They call me now the hot dog guy because we published this 36 minutes of life lost per hot dog a month ago. And it got viral. Like I've heard 1.3 billion auditors have been reached with that, which was quite amazing for once. So I don't know, Jackie or Laura, do you want to go?
Yeah, sure, I'll go. I'm Jackie Goodrich. I'm a research faculty here. I do a lot of work with maternal and child health, and I actually also studied toxicology here, so I know from the program from inside and out. And Laura, do you want to go next?
Hi, everyone. I'm Laura Rosick. I'm an associate professor here in environmental health. I direct the Center for Southeast Asian Studies, and I'm a cancer epidemiologist. I do a lot of work in Thailand. In fact, I have a call with them in a couple hours tonight.
Aurora, do you go?
Yes, hi, I'm Aurora Lay. I'm an assistant professor in the department, and I'm one of the core faculty in the industrial hygiene program. I do research in occupational health disparities, infectious disease mitigation and management, and psychosocial factors of health. I'll pass it to Pini.
Hi, everyone. I'm Pini Pereira. I'm also a research faculty in the department, and I work on environmental influences that can change your gene regulation and later life outcomes.
John Wood, you want to go? Dr. Shi?
Introduction, self-introduction?
Yes, 2 words.
Okay. My name is Chuan Wu Xi. I go by Wu, so I'm a professor in the department. I'm environmental microbiologist and doing a lot of work with water quality in the different parts of the world. So recently I'm working on the COVID, I think probably in half an hour or something like that. Very welcome. Thank you.
Okay, Rachel?
Hi, everyone. I'm Rachel Yarbrough. I'm the graduate program coordinator. So if you have questions from applying to becoming a student in the department, you can reach out to me.
She's the perfect coordinator. She's the one to go. If you really want a good advice, go to her. If you want some scientific advice, we can still be useful from time to time. Kelly.
I'm Kelly Chanteloy. I am the executive secretary to the chair of the Environmental Health Sciences Department. So I work for Dana Illinois.
Okay, so we'll have a short presentation, and it would be a bit long with 30 participants to have everybody introducing themselves, but we, based on your application or your registration, we've been, it's a bit awkward there. The slide, do you see it well? Or? Let me try to share mine. Okay. And I'll go a short introduction for who is on our call based on your registration. So of course there are quite a few people from Michigan, but also from Nigeria, Puerto Rico, Connecticut, India, Ghana, Texas, Maryland, Indonesia. So it's nice to see the diversity, and that corresponds also to a diversity of our students. You have on the right the cities where people are coming from, which is pretty nice in terms of diversity tonight. Now, what is our background? We can see that biology is a strong background among you interested in the area, and also in our students who have studied public health, but also very diverse also background in psychology, biochemistry, sociology, chemistry, biomedical science, and medical science as such. And this also corresponds to this diversity that in environmental health, we need this different training or ground training to go. And we have about half who registered are working professional, less or more than 5 years, and the second half are graduate or also some undergraduate senior, junior, sophomore. I think we have 2 freshmen and a high school senior who is here, which is great. So a warm welcome, and let's have a short overlook of the department and the studies, and then we will take your question. After that, we will do breakout room on different topics, and we'll switch. In fact, you will stay in the breakout room, and we will move the faculty, or Rachel will move us. And finally, you will have a time with 3 or 4 of our students who are presently studying here, so that you can really ask all the questions. We will disappear, we will not attend, and you can ask them all the questions you have directly. Okay, so to finish with the introduction, we will launch a Zoom poll, and you could say, what does EHS mean to you? And what are you passionate about in this field, or more broadly, as you like to answer? So, Jackie, can you launch the poll?
No, the poll function isn't working. So we were just going to have everyone answer these questions in the chat. So we'll just have a chat waterfall, and
okay.
Tell us your thoughts to these questions, and you can see what everybody has to say.
So you please use the chat. Let's see. At least one answer per person. That's participation is important in our studies. It's key to learn, and okay, let me enlarge a bit what we have here. Environmental to me means protecting the earth and people health and well-being, and adverse weather event and how they impact vulnerable population. Yep. And we have one colleague, Mary O'Neill, who's an environmental epidemiologist who is working like on heat wave and impact of climate here, which is great. Environmental stewardship and caring and protecting people as they interact with our environment. Okay, thank you. That's nice to see. And
yeah, everyone, you can keep putting your thoughts in there, and we'll read them. And I think it helps everyone else too to see what this field is really. It's specific, but it's also broad. So there's really a lot of things, a lot of people that come together from different backgrounds to be in environmental health. And there's a lot of interesting things we can work on together, which we'll talk about more today.
Okay.
In
so
the next decade, you would.
Sorry, what did you say, Chenwu?
I said in the next decades, the students will define what the environmental health are.
So let's see how we define it here. That's a complementary definition, but you've covered most of it. I think if we think we are trying to go from the causes of environmental related problems up to the impacts, and you will get courses and be exposed to research, and our faculty are doing both in that case. From the cause, which start from industrial activity like electronic waste recycling. That was a project where students were sent in Thailand to work with e-waste recycler. We in fact just publishing a paper on that recently. Then we will go, these activities have influence on the environment, and we learn to sample the environment, to look at the status, to evaluate and identify hotspots where we need to intervene. Worker are also exposed, and that's Aurora in industrial hygiene is worker, and we need to mitigate worker exposure to chemical, which is an important impact with in fact millions of lives yearly which are exposed in that case. Now it's interesting because chemicals are not only in the environment, we are also exposed in the near field environment. And we have here the daughter of my senior collaborator, who we calculated she has about like 50 kilo of plastic in her room, and is exposed to this plastic, and we can look at exposure from consumer product, from the ambient to people. And once people are exposed, then there are effects, and that's what, for example, Laura and Pini are researching here, or Jackie, looking at and understand and mitigate health effect of PFAS, of different substances in that case. So we try really to understand and prevent. Really, environmental health is a science of prevention, and to prevent, we need to understand causes and act on these causes. And that's, in a sense, we are just above the medical school or the hospital at University of Michigan. And our goal is to avoid that people have to go in the hospital because they've been exposed. And that's always cheaper and more efficient in a sense when we do that. Okay, why EHS here at the University of Michigan? Different reason. One, you get a relatively low student to faculty ratio, which is great because we know each of you and we get to know each of you, and you get a personal contact with the faculty here, which is really great. You find a job relatively easily. 97%, that was in fact a year ago, were employed. So within a year, we had nearly the total cohort of our graduates which were employed, and 93% reported satisfaction or high satisfaction in their job. You get a good entry salary here, and as a Swiss, I'm not too keen on we are number 1, number 5, and so on. What is sure is this is one of the best university and best public university. And personally, when I came here in 2005, I was also interviewed in Stanford, and I really like the public spirit of this university, the sense of service, of we are here to serve our world. And this is something you find in a good public university and an excellent school of public health. And in addition to that, we have a great network of 4,500 alumni. And this is not alumni from School of Public Health. This is alumni from environmental health science. Wherever we go on a congress, we visit, we find our alumni. We say, oh, by the way, I'm from University of Michigan. And that means it also helps. That's one reason why we have this high employment rate, because you will find help from our previous alumni here. What type of career? There are career in government and university, in consultant firm, in multinational corporation. And if you look here, we have about a third which is industrial or commercial firm. We have a quarter which are in university or colleges and pursue more research here. Quite a few in non-profit organization, consulting, federal government, health insurance, and different other activity, and really all sorts of company which are here in our case. So I will pass the word to Jackie to continue to introduce the culture of our department and how it goes. Perhaps you can use your slide directly, Jackie. If it works.
Penny's going to talk about the culture. So go ahead, Penny.
Hi, everyone. I'm Penny, as you heard before. I'm also a part of the departmental DEI committee. In case you don't know, DEI stands for diversity, equity, and inclusion. We try to create an inclusive and diverse environment that listens to the needs of our students, faculty, staff, postdocs, as well as our community. Next slide, please.
Hang on a second. There you go.
Sure, thanks. So these are some of our core values in the department. We believe in compassion. making sure that every individual is well respected and that everybody's voices are heard. We also believe in innovation. This is a very big component in our department, promoting a very creative space to generate a healthier, more equitable world through a lot of our highly competitive research that we do here. And we also believe in inclusion and also collaboration. We collaborate with a lot of colleagues through the School of Public Health, through the university, and also across the globe. And we also believe in impact, making long-lasting positive effect in our community and the world. So DE&I play a big role in our department, and please let us know in future if you're interested in taking part in a lot of these DEI initiatives.
Thank you, Dr. Pereira. And I'm going to try to go rather quickly through the overview of our program. We want to make sure there's plenty of time for questions and for you to actually interact with us. And because some of this information you can find on the website too. So you probably already know since you're here today, but we have 3 different major kinds of degrees that we offer here. We have a Master of Public Health, which is considered a professional degree. It's 4 semesters long. It involves an internship or project type component in the summer between the 2 years, and it's designed to prepare you for an EHS professional career. We also offer a Master of Science degrees that students tend to complete in 3 to 4 semesters. It has much less coursework than the MPH, and you spend a lot of time doing research and essentially writing a research paper, which is your thesis, and defending that, and that's often publishable. And then, of course, we have a PhD, which takes, anywhere from 3 to 5 years, depending on where you're coming from before your PhD. And of course, that's not a lot of coursework, tons and tons of research, and really getting the skills and the tools to become a leader in your specialty area. To show you a little bit more about the MPH, which is the degree that tends to have the most students in our department, everyone will take a common core in exposure science and health, toxicity and toxicology, occupational environmental disease, and integrated approaches and professional perspectives in environmental health. So this is a group of classes that everyone will take together. And it is a lot of credits. It's 60 credits over your 4 semesters, but you do get some credits for your internship in the summer as well. And within that, even though environmental health is already a specialization, you can specialize more within some of the extra classes that you get to take. So there's a lot of core courses that everyone takes together in the department. There's another set of core courses that everyone in the whole school actually takes, like intro to biostats and epidemiology and things like that. But you have a big chunk of classes that you have selection, and you can choose to go general with EHS and just choose whichever electives you want, or you can pick a certain track and take the classes in that track. And those specialties that we offer this degree in are industrial hygiene, occupational environmental epidemiology, and environment, sustainability, and health. And since all of these things might be, foreign to you, what's the difference between these different tracks, we are going to briefly talk about each one. So Dr. Lay, would you mind talking about IH?
Yeah, thank you, Dr. Goodrich. So exposure science or industrial hygiene, a fun fact is before the Michigan School of Public Health was a school of public health, it was actually the School of Hygiene. So we have deep roots in industrial hygiene. And really an industrial hygiene student, you're going to be focused on learning the different facets to evaluate, control, and identify different workplace hazards, whether that be chemical, emergency, biological, radiological research, and so on. We do have funding for this particular concentration if you're interested in it. And many of our students successfully obtain internships and go to industry. We have an award-winning student association chapter that has won the student chapter award for the last 6 years. So there's a lot of collegiality. Students have interned this summer at Tesla, at Boeing, and so on, and have gone on to get jobs in industry. So we will have an IH specific section info session on November 8th from 1 to 2 p.m. Eastern time if you're interested in signing up to learn more about IH. Thanks, Jackie.
Thank you. And next, Dr. Joliet can tell us about E, S, and H. I think you're muted if you're talking.
Olivier, you're muted.
Thank you. Sorry, I'll restart. So on environmental sustainability and health, if you're interested in sustainability and the long-term project for our planet, not to exceed the planetary boundaries, that are especially interesting in health, this is exactly the sub-theme you want to look at, which is deepening the health aspect of the sustainability in that case. And as you can see, I mean, I was just Googling a week ago, there is like more than 4,600 jobs which are looking especially specifically at environmental health sustainability managers. So bringing this broader view on carbon footprint, on different type of impact in addition to the health is becoming key. And you have here an example of 5 of our main courses that you can take, while you can also take courses in different schools like the CES or the School of Environment and Sustainability to complement what you get in our department.
Thank you. And Dr. Rosa, can you tell us about O, E, and E?
Yes, thank you. Hi, everyone. I really enjoyed reading through just now some of the things that you put in the chat, especially since I see so many of you are interested in a lot of the things that we do in occupational environmental epidemiology, which is using analytic methods. And I use a lot of integrative epidemiology where I look at genomics and epigenomics to try to understand the complex interplay between social disadvantage, racial disparities, and your environment and how they lead to disease. With that, if you were interested in environmental epidemiology, you could either apply to that through the Department of Epidemiology, where you would take half of your classes in environmental health, or you can, of course, apply for an MPH and EHS, and students that have worked in my and other groups have gone either route. We're an incredibly integrated school, and it should just say something that I'm a cancer epidemiologist and I'm an EHS. So there aren't a lot of barriers to going between the departments. But with this, you learn both the statistical methods as well as understanding the mechanism behind this, whether it's toxicology or whether it's genomics, to try to predict the causes of disease in the complex environment where we live. And I'm happy to answer questions if during our period, or if you'd like to email me after the session. Thank you so much for coming tonight.
Thank you. And lastly, I'd like to tell you about one more MPH degree that we have, specifically in environmental health policy and promotion. And this is a pretty new degree, and the students who have completed this degree have really liked it, where you take a good chunk of your classes actually in the health behavior department and in the policy school. And people that, go into this particular degree really want to, go on to influence environmental policy, maybe work for government, do things like that. And so if, you don't want all of your classes to be more hard science and you want some of them to be more policy and health education and things like that, this could be the route for you. And I'll just briefly, the rest of the degrees we'll just briefly talk about. For the Masters of Science, you can focus in similar areas. You can focus your classes, once again, in industrial hygiene, in environmental sustainability and health, or in general EHS. And if you're in general EHS, you can take, some more of your classes in epidemiology and things like that if you would like to. You can also get a MS degree in toxicology, and I'll tell you what that is in a second. And then, as I mentioned before, you really spend a lot of time, getting into a research group, getting to know your research group well, and carrying out a research project to its completion when you take on this degree. So what is toxicology? That's actually what I studied here at U of M, even though now my research is in toxicology and environmental epidemiology. But this is really getting at the health effects of some of those chemicals and hazards that are out there. So what we do in toxicology is really analyze the hazard, the chemical, figure out what it does at a molecular level, at a cellular level, to a tissue, And then we use this information to try to figure out, how we can prevent, or well, to contribute to risk assessment, so we know what chemicals we may need to regulate better, but also to figure out some possible interventions to help people who may be experiencing toxicity as well. And I'd also like to briefly mention that we have kind of a new program called an Accelerated Master's Degree Program in Environmental Health Sciences. If you are here from one of the undergraduate institutes listed on the slide, you'll be eligible for this program. At this time, the program is only for students who are completing their undergraduate degree in these schools. And if you are interested in this program, I encourage you to contact us, because the application procedure is pretty specific and it has to be on a pretty specific timeline. But essentially what you do is, in a 5-year span, you earn the bachelor degree from your institution and also the master in science degree from us. And you do this by, during that 4th year of school, you take classes essentially from each, and in your 5th year, you're completely with us on campus here. And there is a priority deadline for applying to this program, which is December 1st. And the application procedure has to go through Rackham, and we have this information on our website too, and we can also put the link in the chat. And if anyone has questions during the question and answer session, Dr. Shi, who spearheads this program, is here, so he can help answer questions about it. And lastly, if you're here applying for a PhD, you probably already know all about this, so I don't really have to get into it too much. But usually everyone takes about 3 to 5 years here to complete their research. They find a group. You spend a lot of time really digging into a complex topic and mastering it. And then you end up writing, 3 or 4 publishable papers that become your dissertation, and you get to defend that and showcase that work at the end, which is always a fun time. Well, that's a lot. That's a lot that we just covered, and there are many different, neat classes and neat subject areas. If you want to learn even more, there you can always take additional certificates or additional classes in these focus areas that we have listed here. The University of Michigan has a lot of neat certificate programs where no matter what school you're in, you can take these, this special group of graduate courses in this topic area. And then when you graduate, you can say, I got my EHS degree. I also have a certificate in environmental justice, or whatever the case is. And you can dig into these topic areas with some of your electives. I'd like to point out briefly that we're a school who's really into global public health. A lot of our students do their internships or even their master's or PhD research in other countries. This is just a list of places some of our students have gone. Obviously, during the pandemic, it was a lot harder for people to do their internships overseas. Some people actually worked with international organizations virtually for their internships, which worked out pretty well for a lot of people. But this is something that we support here. We have an Office of Global Public Health that gives out lots and lots of scholarships to cover global internships, and we have a lot of great resources here for that. I know everyone here, I'm sure, wants to know about funding for your degree, because of course graduate degrees are expensive. I believe the school is also hosting a separate session just on funding, but I wanted to mention a few things here. Some of our students end up getting merit-based scholarships that are offered after the application process, after we start admitting students. Some people take TA, or what we call graduate student instructor positions, where you teach, in a direct graduate course, and it covers your tuition and gives you a stipend for a semester. Some people do paid research while they're here. There are also lots of other organizations that give out fellowships and scholarships within the university that you would be eligible to apply for once you're here for, your second year of graduate school. And then within our own department, we have a few special fellowships and training grants that we offer to our top applicants. One is for people interested in industrial hygiene and occupational epidemiology, which can fund master's or PhD students. And we also have a training grant that can fund PhD students. And I believe this is the last slide before we get into questions. You can ask more about this during the question session, but if you're applying, what is important to us. We do actually read through your entire application. You have to write all those statements and everything, and you may wonder, does anyone really read them? Well, we really do. We really take into account what you put in your personal statement and your statement of purpose. And of course, you know, we look at your, you know, your transcripts and your history and all of that, your background in the field. But we, you know, if you feel like you're missing something, maybe you missed out on a research opportunity because of COVID, maybe you had a couple classes that didn't go well because you were having a bad year that year of your life. These are things that you can point out somewhere in your statement and just say, you know, hey, I know there's a hole in my resume here. I was struggling that year, but this is how I overcame that. You know, the next year I got A's in all my classes, or I found an online internship instead, or whatever the case is. So you can really use those statements also to showcase your strengths beyond what we just see in your grades. And of course, the letters of recommendation are really important. You want to have them come, you know, if possible, from people at academic institutions you've been at, but they could also be from employers too if they're in a relevant field. And we used to require the GRE, but we don't anymore, so that's good news. And sorry about the young prospective student who's joining me now. But so with that, that's the end of our formal presentation. We're going to take questions, and after that, we're going to do some breakout rooms where we can talk even more in smaller groups. So you should be able to just speak, or you can put your questions in the chat.
And I will say Kelly right now is putting all the links to the concentration specific sessions in the Zoom chat. So register for those. Even if you can't attend, you'll be sent the recording. So please do make sure to register anyway. Yeah, don't be shy. If you have questions, unmute yourself.
Okay. I can say one thing which is really interesting here at U of M is the interdisciplinary spirit. And the fact you can really navigate between school, and that's valid both for the teaching and the research. And that's really decided me to come here. When I was interviewed, I thought on like 18 people I was interviewed by, I could work with 12 of them. And I mean, we've been indeed working across school and discipline in an incredible way. So that's really unique university. All universities speak of interdisciplinary, blah, blah, blah. This university put money. And we have possibility to create, we call it cubing, 3 professors. We write an abstract, and we have a $60,000 project going that we can hire students to work on. So this university is unique for that.
So we have a question. What percentage of students pursue global health research in another country? Maybe Laura or somebody, if you could address this.
Yeah, sure. It's hard to tell every year what percentage of students. So the Office of Global Public Health in the School of Public Health usually funds between 30 and 40 students school-wide to go on internships overseas and pretty much all over the world. I've had students, I sent students to Thailand. I've also sent students to Ethiopia and Indonesia. As well, that doesn't cover the full complement of students who go overseas because there's funding available from the International Institute, the Wallenberg Fellowship and such. So while we can't tell you the proportion of students, it certainly is a good deal of students here. And Wu can probably talk a little bit more specifically because he directs our global environmental health program here.
Thank you, Laura. Yeah, I think the global health experience is really appreciated here, and students want to pursue that, and we have the funding to support this. So it's very important to have the funding to support this. Whether you are doing the MPH, MS, PhD, we have different mechanisms to support you go to abroad to get some global experience. So I will not say 100%, but it's pretty a big portion of our students do have international experience. So if you want to have some global experience, I think you have a plenty of opportunity here. And also we have the funding to support you to do that.
We were actually pretty lucky this last summer with one of my students who had received a decent amount of funding to go to Thailand to do water testing. And unfortunately, the COVID situation with the Delta variant made it impossible for her to travel there. But she was able to virtually design a project with our collaborators at Mae Fah Luang University in Chiang Rai, Thailand. And they're collecting the water for her. They Zoom and they analyze the water samples. And we are doing a virtual global project. And at the same time, she has she's learning Indonesian as well. So there's definitely ways. I wouldn't be deterred by the things going on in the world, because it is incredibly important that we all work together at this time, and there's many opportunities to do so.
So Kate has a question. I have an environmental science policy background. I have been working in data analysis, but I do not have any background in health specifically. Is there anything I should note in my personal statement to regard that lack of experience in the health field, or since I would be applying to HS, is a background in environmental health and environmental science considered sufficient? I don't know. For me, it's clear that if you have a background in environmental health science, you don't need to have the health. It's why you will come here. You will get your health background here, I don't think it's a problem. There are some prerequisites depending on the option. There is a biology class for doing the EHPP, the Environmental Health Policy and Promotion and Policy. And we have a biology plus chemistry for the other, and industrial hygiene is a bit more requiring, want some physics also. We're still on, Aurora.
Sorry, say that again.
No, I'm saying, what are the prerequisites for environmental hygiene?
Oh, industrial hygiene. Okay.
Yes.
Yeah. So for industrial hygiene, you'll need organic chemistry, general chemistry, physics, and biology. So similar to what you might need if you were to take a pre-med course. Some of the students who may have already graduated are in between times. We do have students who go back and take those specific missing courses at a community college or through an online program, but you can certainly ask us more questions about that in the IH specific section.
Okay. And we have Barry asking, I have a background in applied mathematics and demography. And in my last year PhD statistics, is it possible for me to register for health environmental research? So you're around, Barry, you're already finishing a PhD in statistics, correct? So my recommendation is not to redo a PhD. In that case, I mean, I would rather try to find a place to carry out research and do the next step. I mean, as a postdoc in statistics, we have quite a few need for statistician, and I would recommend rather to come as a postdoc than trying to redo a PhD. Even if a tuition is always welcome, I think it makes more sense to do that. I don't know if other have an advice there.
Yeah, I was thinking along the same lines, but Barry, that sounds like a big decision if you want to try to go for a double PhD. So you might want to talk to one of us separately about that. Also, Rachel's been answering a couple of questions in the chat. We should probably just do a couple more and move on to our next thing. But I do have one more comment on Katie Priest's question about in-person and hybrid Zoom. This semester, our residential school has been fully in person. You know, very occasionally you'll have a Zoom class for a day or something because of something going on with your instructor. But for the most part, yeah, we have been committed to having an in-person semester. There's just a couple classes that are virtual, but they've been very explicit up front that those are going to be virtual for the semester. And there are a couple of questions. I'm trying to condense some of these together. I think a couple of questions from the some international students are about funding, it's true that many of our funding sources are only reserved for American citizens or permanent residents. So do any of our other faculty here have tips on how international students can get funding or the chances of funding for international students?
So for the MPH, there's some limited number of international fellowship for international students, but it's quite competitive. But we do have some for international, reserved for international students. The other one for the PhD, if you're admitted and your primary advisor faculty has a research project, you can be supported by the GSRA called research assistant. So that's the other option that we can have. After you arrive here, there's some 1 or 2 semesters of international students fellowship from graduate school, from Rackham Graduate School. So that's about it.
And for the internship, you really get support different way. First, we have every year a poster session where the previous students are presenting their internship, and that's a good opportunity to see different options for internship. There is SPH, School of Public Health, has a support office for getting the internship, and then you can also get support from personal contact with us as faculty if you're interested in something specific that we could perhaps facilitate and help you for that. So this is, I would say, apart last year, a year ago, I mean, in 2020, the internship was a bit difficult because of COVID. I think it's coming back this year, and we will be probably strong next year. That's not a major problem, I think. Okay.
I think we answered most of the main questions, but we're about to break into small groups. So if you feel like we didn't answer your question, feel free to just speak out and bring it up in the next section. So now this will hopefully work. We're going to get split into 3 breakout rooms, and you will get a chance for about 5-10 minutes each to talk to groups of 2 of us about specific topics in this field. But feel free to ask us any questions while we're in these rooms, even if it's not related to that topic too.
I'm going to open up the breakout session separately.
Hello.
You have.
Oh yes.
Yeah. What's the GPA requirement for PhD applicants?
We don't have an absolute requirement as such. The best your PhD, the better. But PhD, I mean the GPA. But GPA is just one element and we really look at the overall quality and courses and experience that you can have. So I would say you can try. I think for PhD students, what is important is to find a potential mentor. I mean, I would advise take contact with. I mean, look at the website very carefully. Each faculty has at least a page, but also often we have a research website, and you can proactively contact us and say, okay, I have interest in this and this. This is what my skills, and try to already find a match before that. That's simple. The advice I can say for PhD. Okay, I think we'll break out in groups, and we can continue in the groups.